Okay, everyone, I'd like to introduce a special guest we have today. This is Kathy. I'm not gonna try to pronounce her last name, but Kathy has a long relationship with our communities. She comes as a representative of Compassionate Community Care, which does a lot of work with outreach with vulnerable people in our society. And is working to prevent euthanasia. That's how we met each other.
That's right.
And you've been with us up at the refuge,
Yes.
offering trainings for people at St. John's, to visit people. And we've had talks here, we've had workshops, and we're so glad you're here to continue that relationship.
Thank you so much.
Big hand for
Thank you. I appreciate that very much. I'm just going to check in with our online people. Can you hear us all right? Yeah? Thumbs up if you can hear us. Perfect. Okay, great. Wonderful. Okay. So I'll ask for, if anyone has any questions, feel free to jot them down or keep them in mind for the end. We'll try to present to everyone and then we'll have answering questions afterwards. Okay, excellent. Okay, perfect. Okay, excellent. So I'm very excited to be here with you. I'm very excited that we're here with you today. We are recording today's session, so if you'd like to share it with others after today, we invite you to do that. We also have a sign-up sheet here at the front, and we have some information brochures. Feel free to take one. We also have a little handy brochure for any of you who are inclined to join us with our initiative, specifically today, the Connecting Community of Hope Outreach Connecting with Seniors project. We'd welcome that. And you can actually sign up to be a trained volunteer to do calls today after the session by simply filling in the form in the middle and giving that to either myself or Suzanne or Father or Brother Luke or anyone here that's with us. They can pass it along to us and we'll contact you today and actually get you started. Okay. So without ado, I'm going to just segue quickly into a little presentation about who we are. Compassionate Community Care is an organization, charity-based organization out of London, Ontario. And we service all across Canada. So we've been here we've been here at the mission, we've been to the Madoc and the refuge there. And so we're very happy and thrilled to be with you here today again, and to share some of our information as it is valuable for you. It may affect someone you know, may affect a loved one, a friend, a neighbor, someone in the community, someone you can pass along a card to. I'm going to share a screen here. Today's initiative ultimately is for us to showcase with you how you can become involved ultimately and how you can be an active player in making a real difference in the lives of others. And so when we're sharing with this about this initiative, we often want to share with you ways that you can do this in your community. Obviously, you have a very dynamic, active community already, and so that's lovely to see. But for any of you that would like to continue working and volunteering by being either a caller or visiting in the ministry of visiting seniors or others in the community, we invite you to do so. So we have a very handy program. We'll share a little bit about that today as well with you. So you'll have all of that information. Ultimately, Compassionate Community Care is a registered charity comprised of healthcare professionals, volunteers who provide support. And that can be to vulnerable persons, their families during times of crisis and illness. We believe that all human life has equal dignity and that every person deserves to be treated with respect and compassion while receiving the care they need and deserve. So whether you're facing a chronic condition, end-of-life situation, or disability, we are here to help. We have a toll-free and confidential helpline. There is a business card here on the table for you. For those online, you can receive this through our website or email. This card has actually saved lives. So people who have received this information have passed it along to others and have called us, and we are literally a last case resort, a last call as they call it. And it often will find people can call us through various agencies, they get referred to us, and for someone who's facing end-of-life crises or they're considering euthanasia or MAID in Canada term called medical assistance in dying, they will call us and we'll help them provide advice, support, and resources for them to choose life affirming and ultimately choose to live well naturally. And so we will take calls 24 hours a day, 7 days a week. Most of our calls will come in right before the holidays. So right now, leading up until Easter, is a very busy time, Thanksgiving, and most busy is actually is Christmas and New Year's. And just after New Year's, there's this blues, like the January blues. We have a lot of calls that come in after that. We've received calls from people who were, considering MAID. They were given no other options. They were alone, lonely. And after speaking to us, we got them the help they needed. They changed their mind and actually lived. So resource, it will save lives. So please do take a card. Doesn't cost you anything, and we're here available, ready to serve. We also have a non-toll-free line, and that's available. I'll give that information to Father, and so you'll have that as well available to you. And you can contact us there for any resources. So Compassionate Community Care started in 2010 from the need to protect, educate, and support those who are most vulnerable. And since then, we've had a number of training opportunities. We've offered events, speaking engagements like this. We've also had events where we speak to people about elder abuse and preventing elder abuse, because we see there's a bit of a systemic abuse challenge that happens. People fall into some kind of elder abuse or neglect. They end up having or feeling that they don't want to live, or they have suicidal ideation, and that spirals where they continue to actually neglect themselves and their own needs. And so if you can prevent elder abuse, you can get ahead of that curve and prevent that following spiral. And so what we've seen now is that we had 3 events, 3 fantastic seminars. They're available on our website, beingwith.org, where you can watch these seminars. There's a lawyer who's a Canadian-known, very prestigious, very well-known, acclaimed lawyer who does health law, human rights law, and constitutional law. And he worked with us to do the seminar to help you prevent elder abuse. You can share that with your community. You can share it with your loved ones, your family, and get ahead in understanding what are some of the things that you should look for legally, and also when it comes to state financial as well. The other 2 speakers we had were 2 nurses. They spoke about before COVID, during and after, talking about things that often people don't realize may actually be considered elder abuse. So it's important to see those practical tools and ways to actually strategies to help them stop it. And then finally, we had a lady from Elder Abuse Prevention Ontario who shared with us real strategies on how to help stop elder abuse before it starts. Ultimately, our agency provides support, advice, and resources in patient advocacy. So we've been advocates for people. We've also, I'll take your questions at the end if you don't mind. Thank you. And conflict resolution. So when there's parties that are involved, let's say a sibling between another sibling, there's a conflict of interest, and they have treatment concerns around their loved ones, we can actually come in and actually help solve and resolve some of those conflicts. We also provide education. So there's a number of resources we have available every day. You can log on, you can jump online and actually download those resources. They're available, they're free. I brought some with me today. So for those of you who are here in person, feel free to peruse our materials and our training materials. We also affect change when it comes to treatment issues. So if someone feels that they've not gotten proper treatment, or they don't know what treatments are available to them, they can contact us and get a second opinion, okay? And we can connect them to wonderful resources in the community, from pain management specialists, mental health specialists. We can get you actually on the phone with a counselor, trained psychologist, who will help you work through your issues when obviously other parties may not be as readily available. We've also had people who want a second opinion simply for their healthcare needs. They want someone to talk to, they want someone to visit with them, or they just want simply someone to be knowing what's happening and if this is in fact proper. We are here to build compassionate community care communities, people, individuals who will actually rally around the individual, creating what you have here, a wonderful sense of belonging, support, and community involvement. What obviously does this mean in terms of last few years? Well, we saw COVID impacted a lot of people, right? And COVID, I found, was especially meaningful because on my presentation, if I had one, you would see there would be a hand of a little child and an elderly person on the other side, right? And that idea, that image of speaking through glass, meeting people, kind of where they were at, and helping them resolve some of their issues, but having that, that disconnect because of what obviously COVID did. It drew a line between people. And so some people, we actually surveyed. We did a Canada-wide survey of over 500 Canadians. And we found that from those responses, there were 3 major groups. One group were individuals, seniors, anyone 55 plus, who were surveyed and said that they remained connected with their community, their loved ones, their friends, And they found that was very beneficial. You know, they found their tribe, as you call it, their center of support. And they found it an enriching experience, that they could actually connect with people that meant something to them. And they felt that they were valued and members of a community. The second group detached themselves completely from more people, their closest community. They actually were alone. They found themselves quite feeling desolate. They found that they fell into feelings of despair, depression, loneliness, suicidal ideation. And some of them thought that they were really at their end, you know, they didn't feel like they had much hope. And so they would have wanted to be in the first group. The third group was a very interesting group. These were people that had only one person, and that's important. There was either a friend, a pastor, a loved one, a spouse, maybe a child that would come routinely and check on them. It could have even been a pet or a belief in a God, a higher being, God. And so that is a being that actually helped them come through COVID. And that was one thing that made a difference for them. And what those people recall is saying, how if they hadn't had that one person, that person that came and visited them, the neighbor, the friend, the sibling, they would have not been able to manage through COVID. How important it is to just have one individual in your life that consistently is there for you, that you can rely on, that you can connect with and be a part of. Okay, so it's very important. What we're trying to do here is show you how important it is to visit and connect with and be with one another. They say chronic loneliness is an impact to your physiological as well as your psychological state. It can impact you with chronic loneliness. It's similar to what they describe as smoking 15 cigarettes a day. That can have the same physiological effects, right? So it's very stark, and it's a warning for us, all of us, to be able to be in communion with one another. You know, God made us to be interconnected, and it's really important that we engage one another, stay in connection with one another. By being with others, and by visiting with the lonely, by partaking in the calling service that we're going to share with you today, you are actually impacting that change and making that difference. You're being that one person in someone's life. We can change the world one person at a time. You can protect people by caring. And by caring for our own starts with our own circle, our family, our community, and making that difference in your circle. One of the ways you can be with one another is actually learning how to visit. And so effectively visiting means you can partake in our training. We have a free online training happening actually tonight. So for any of you that sign up today, I can send you the link to register at 7 to 9 p.m. tonight and tomorrow night. There's 2 sessions. You'll learn how to be part of our visiting community and learn how to visit. It's called the Being With My Story. And what we do is we use a book called the My Story workbook, which is right here. So we have an example here for you. And what it does is enables you to interview the person you're visiting with. So you'll actually meet with a person. You can do this on the phone, and we can incorporate this into your calls. So if you're joining us as a caller, you can actually use this program and interview people on the phone when you meet with them or when you speak to them on the phone or on Zoom. And so what's really lovely about this program is it's short. In 4 hours, you're going to learn how to be visiting with others effectively and how to make a real difference, okay? And it's beautiful because it builds legacy. It creates a sense of value and importance for the person you're speaking to. And they really appreciate that time that you're spending, that effort. Because ultimately, you could take this workbook and say, this is yours, right? This is your life, your legacy captured, and you're giving it back to them, you know? So it's a wonderful opportunity. And members of this community actually have gone ahead and taken this, and I'll show you examples of it, how beautifully they've actually, you know, been able to participate in this program. Our point and role here is to empower you to empower others, to be a force, to be social ambassadors, that you can actually be friendly visitors and callers. And what you will find when you do these programs is you'll get a training manual, but you also get a workbook. In addition to that training, through that training, we actually focus and hit on points, for example, like patient advocacy. How important is it to be an advocate for someone? Sometimes someone will ask you to accompany them to the doctor's office or a specialist appointment. So we encourage you to take that opportunity. You know, obviously, if you're representing their values and goals, you can partake in that kind of experience and share that so that you, in turn, can actually help impact them in a positive way. This is different, right? When you go to the doctor's office, you have someone with you versus if you're alone. And you can be an advocate for them. So that is available as well. Ultimately, our suicide prevention, we see, starts with also and includes assisted suicide. And so we see that this tidal wave of MAID or euthanasia in Canada has really evolved to the point where we're one of the leading countries among all nations that have legalized euthanasia. And so, this is an effect that we want to help you equip yourselves to be able to be partners in change, challenge the culture of abandonment in our community, in our cities, in our churches, and in your neighborhoods, and be those wonderful ambassadors of light that you can actually help. If you don't have a question, feel free to give us a call, use our helpline service so that we can impact more people and help you with them. Finally, I'll mention this. We did a survey of people in our community, and we published a book. We have a copy here for you so you can actually see. This is called the Ladies of London. They published this, the CWL ladies, and we published this for them, which is a series of stories and interviews that these women partook in. And you can see there's wonderful pictures and stories. There's a lot of family that's mentioned in here. And you can see it's wonderful because it's illustrated with their legacy, their ministry, how they served in the community. You could do something like this here at the church, at this community in parish that you can actually partake in and bring that forward. Have people involved in who's been involved, both volunteers, members of the congregation, and simply working within the ministry and church here. There's so many ways that you can help: visiting in pairs, visiting the Lonely Calling seniors, and learning a little bit more about how you can become involved here at this ministry and hear what you're doing already. So thank you so much. I'm going to segue into our second session, which is Connecting with Seniors Project, and with Mrs. Suzanne Muzilki.
I'm Suzanne, who lives in Scarborough alongside of Kathy, and I started with them last fall and have started a program, designing and developing a program for connecting volunteers with seniors in our community. So the way the program works is interested volunteers it's actually quite a simple process. I've left it fairly simple. I think, Kathy, you've got you can sign up today or just fill out your name and information online through the website. And you simply actually start with the screening process. Hi, how are you? That's okay. I'm Suzanne.
Yeah, I really like this thing because I'm actually very interested.
We just sort of started talking about the program. So I'm working in the Connecting with Seniors area, developing their program for connecting seniors with a volunteer. So really you're coming into the program, filling out the sheet online and providing me with a little bit of information about yourself. Once I receive the information, I go ahead and qualify you. I like to speak to the volunteers directly, get a feel for some of the, your interests, why you'd like to volunteer and connect with the senior, what you sound like on the phone, because this program that I'm developing is solely as a connecting over the phone. So you actually don't see the senior. I mean, we offer Zoom with connection, but what I found in the last 6 months is most volunteers and seniors don't want to be seen on Zoom. It's interesting. I mean, it's out there if you'd like to see face to face, but most of the people wanting to connect want to connect with a call. And so once you fill out the screening online, I connect with you and do sort of a brief interview, and we do some training if you haven't volunteered before over the phone. And then I attempt to connect you with a volunteer or a senior who might be compatible with what your interests are. The feedback has been very good. We just actually were recognized by Bishop Hassan at the Archdiocesan level. I was mentioning to you, I've met with the Archdiocese of Toronto in the hope that parishes will put the word out, because there's an awful lot of seniors that don't want someone to connect with within their own parish community. And I thought I would start with, I'm from Richmond Hill, so I thought it's best to start with the community I know, which is the church, the Catholic Church. And so they just sort of accepted the program into parishes. So we're starting to get some feedback and some movement with people wanting to volunteer. Our greatest challenge is the seniors. And so if you know someone who's a senior, maybe you have a family member who's a senior who would appreciate a call, a relative. I mean, we're just at the point where I've got more volunteers than seniors to call. And that kind of makes sense because seniors often are, it's not that they lack interest, but I mean, to put the word out that they're looking for someone to connect with is more difficult for a senior than it is for a volunteer at times. So if you know someone, again, you can also submit their living information and we'll be connecting with them at some point. I think that's.
Yeah.
Yeah, are there any questions about this program that I'm working on? Relatively new, but yeah.
Yeah, but there are actually some elderly individuals that are, you know, mad and grief, usually caused by loss of their wives and spouses.
I actually do have a few in the program. I connect with a woman who's recently lost her brother and her husband. She lives in London. I do have a few. That's a really good question. And that's who we're trying to reach out to is seniors who are often feeling lonely, and you're right. Greater likelihood they'll have experienced loss of a loved one, homebound. I have a couple of seniors who literally just don't get out or don't have anyone to take them out, and appreciate the call once a week. Sometimes I call more than once a week because I'll check in with some of the seniors myself. But yes, many a time, we're not counselors in this program, like we're not able to counsel them. I try to explain to the volunteers again, this is a connection for light conversation. You know, and you've got a sheet of things you can talk about, you know. I had one woman the other day talk for an hour about how she was having difficulty with buying a pair of shoes. And that was okay. That's what we talked about for an hour. A gentleman who is not a Catholic, who I talked to for an hour every Thursday about the Catholic Church. It's a non-denominational program. You don't have to be Catholic to enter the program. But again, you know, if there's a faith dimension to it, I encourage you, you know, if they would like to pray together, we talk about that when I'm doing the training. I have something on the sheet with a simple prayer you can say. So, you know, trying to think of what the question was. Oh, yeah, they come from all different walks. And the connecting part of it is what's important. Because, you know, I'm so glad you called. I've been waiting for your call. You know, I haven't talked to someone in 2 or 3 days. Like this is more prevalent. And then the flip side is what, you know, they seem to face every time they go to a doctor's appointment, or they're talking to perhaps even a family member, is the reality of euthanasia and MAID in their communities. I just recently had a woman who spoke to me. She's going through the end of cancer treatments. And I'd like her to connect with somebody at some point, but she's not ready. But she said she just went for a follow-up to the doctor's office who offered her MAID as an option. And so what I'm saying to you is we're not counselors, and yet we do cover that a little bit, is how to respond to, you know, questions seniors might have on the other end about MAID. So I cover that off when we talk over the phone before you volunteer. And then we have some resources that I provide you with. I mean, again, the idea is just to get the word out. Right now, we really need the word to get out there for seniors in the community, wherever you live or wherever you're at in the workplace. And once I connect with the senior, then I'm kind of building a base from that. So does that make?
Yeah.
Any other questions? Yeah.
Is there an element of the program where people come together physically, such as what we have here, where we sit together, where we have coffee, or that, is there a chance that in the parachute, or maybe like once a month,
I know they'd really like that. The issue I'm facing now, and I'm hoping down the line that will happen, is we cultivate it within communities, especially at the parish level. I mean, that's kind of the outlook, is the seniors and the volunteers are from all over Ontario. So up around the Ottawa area, there's a number of volunteers and a few seniors in the London area that we call. We just don't have them in one place to be able to do that, but that would be the ideal, because I think that would be an important part of it, hopefully, with God's good time. Yeah, that's a really good idea. And you have that with being there, is you have opportunities like this. So.
So if we could cultivate a group here, even at the church, that of dedicated volunteers or callers, who are already calling and the local people are participating in the program, maybe that's something we could look at in the future, is facilitating a partnership where we could come back and meet with and speak with you on a regular basis.
Yeah, great idea.
Yeah.
Thanks, Kathy.
Okay, thank you very much. Yes,
Just one more question about your volunteers. Long term, once you have recruited your volunteers and you have trained volunteers, can you do a follow-up
mhm,
with the volunteers? Is there an opportunity for them to speak to someone about some of the conversations that they're meeting, some difficulties?
They do contact me, yeah. They do contact me, and I make that pretty clear that at any given time they can reach out to me. And so some are better than others with the, sorry for my back, Kathy. Some are better than others with feedback. I have one woman who's a retired school teacher who contacts 2 different seniors, and she's like impeccable about weekly emails to me about how things are going. And then at other times, I go through the list of our volunteers. It's manageable enough now. There aren't hundreds, but certainly I can make my way through the list once a week and say, how's it going? And how are things?
What is the presentation again?
yeah. So mainly how you can be participating as a caller, volunteer, or a visitor. So both are available.
Do the calling.
But really, we were focusing on the calling service and launching it in the community. If you haven't heard about it, here's an opportunity. Get your loved ones, get your elderly people who might be shut in, isolated physically or socially. Don't go out. Get them having to get calls if they like to call.
Concerns.
Yes, call to get. That's right, to have phone calls, conversations, yes. And if you're interested in volunteering and being part of this service, please do pick up a brochure. You can fill it in and then give it to Suzanne, or you can email her directly and call her to sign up. Okay, does that make sense? Perfect. There was a question there. Sorry, do you mind if I ask you what the question was?
A few questions came in my mind, not just last minute, but I just wanted right now. Do you do a checkup on volunteers, their background or?
Yes.
Everything in order to have information from seniors?
Yes, absolutely. Do you want to, we do it on both sides.
We do.
Yeah.
We actually do, you know what, and we have to because, come back up.
Sure.
Is because we've got the police check, the vulnerable persons police check. They don't need to do that quite yet. Like we start with the screening sheet. I collect the information and then I have a conversation with them. Because, for example, I've had a number of people who, after I've spoken with them, they'll say, oh, you know what, I don't want to go to the next step. This isn't what I thought. I thought I would be physically going and meeting with people or whatever the case may be. So the police check is something that happens after the qualifying, after we have that. But we do the police check. And then I always do some background check individually just for my own personal information, but often a volunteer will actually give you the information. They'll give you a bit of a story about themselves. I've been I have a gentleman who's a veteran who served and gave me a bit of background on his life. He's a recent widower. He'd like to volunteer. Like they'll provide you, they're fairly forthcoming. You know what I mean? But the vulnerable persons police check, they have to provide me with so I can have that on file, a recent one. So I think we cover the cost for that.
Yes, we do.
We
We
cover
also,
the cost.
yes, so if any of you are interested, we can cover the fee that's associated with the vulnerable sector check, and we'll pay for that for you, so you can get that. Okay?
Yeah.
Yeah. So there's no issue. If in case a volunteer wants to have it done, we'll do it. Okay?
Mhm.
Yeah.
Okay.
Yeah. Any other questions? Yeah.
I have been in many ways involved talking to seniors in the past, and even a friend of mine who passed away and left her daughters. Another friend that passed away too and left her 2 kids, and many histories, right?
Yes.
So, and the question that I have before is, do you have other languages
Yes.
for people that do not
Yes.
have the English language,
Absolutely. Yes.
so they can feel comfortable?
Yes.
What I found too is that many seniors do not to speak just openly to anybody and talk about their lives. They're very even for visiting. What I have done just on my own is sometimes they call me, they text me, or I call them if I don't hear from them for a while, or text them just to see. Sometimes they tell me, okay, I'm going for an appointment, or I'm going grocery, or things like that, things like that, which,
Yeah.
I feel that, they feel comfortable with that too, for me to know, and, me to hear from them, and, you know, or the weather, we talk about many things that, anything, right, that is
Mhm,
good.
mhm.
And, that's what I have done.
That's great.
Yeah.
Wonderful. About the language point, excellent point. We're actually currently looking for someone who may happen to speak Hebrew. So if any of you know someone who may speak Hebrew, we're looking for a volunteer to speak with a senior who's, that's their preferred language. We do have some volunteers that speak other languages.
We do, we're starting to collect, and actually, that's the other point, I should have made that point, is there are people who come forward and say, you know, I speak. I'm recently from Nigeria, and I have this language, and I'd like to connect with someone from culturally and be able to speak with them. So there are, and I'll put them in that, and it's really trying to match them with the senior that it's, yeah, we do, so.
And at one time, a senior needed, but I couldn't find, because of, appointments that, this person had, looking for a dog walker
Mhm.
while she wasn't on her appointments or any other reasons. And that's another thing that, I would like to look into it, if there's anyone available, at least for 1 hour, I don't know,
Mhm, mhm.
depending on the
Yeah.
kind of baby.
Yeah. So we do have contacts across certain areas. So for example, we have people who visit already in pairs. So someone like that might be willing to do something like that and engage with, you know, dog walking or whatnot. Speaking with someone visiting. Yesterday, we had an opportunity like this at another church in Mississauga. And they had two people there, different groups, one person looking for visits, the other one really wanting to visit. So we immediately connected them. They hit it off. They're going to start visiting this week. A lady has her 2 children living further away in other cities. They don't come and buy, they don't visit. So it was a wonderful match. And so these opportunities continue. So if you want something like that or support, feel free to reach out to us. We'll do our best to try to find someone in the areas we know we have volunteers. Yes.
Thank you.
Yeah, sure. No problem. Any other questions? That's great. So we have another speaker and I'm so sorry about this projector. We had tested it yesterday with 3 IT people. So obviously it wasn't meant to be, but for now, if it's okay with everyone in the room, I'll share my screen here and Mr. Lino de Vicendis, yes, Lino, sorry if I mispronounced, we'll have you unmute yourself and you'll speak through here and hopefully everyone in the room can hear you, okay? Excellent.
Thank you, Kathy, for that kind intro. And yeah, good afternoon, everyone. It's a real pleasure to be with you all today. I'm humbled just to be here for the opportunity to speak a little bit about elderly care, just in line with our theme today, and some thoughts about how we can do it even better and really in partnership with our wonderful friends at Compassionate Community Care. Thanks be to God. So we've got the first slide up, Kathy.
Yes.
Okay, great.
Sorry.
Yeah, we can go back. That's okay. My one other regret, perfect. Not being with you all in person is I'm just noticing just the beautiful, I'm not sure what the proper artistic description of the artwork is there in the church, but just beautiful. Looks like sort of on the Orthodox side of things. So I have an appreciation for that too. But anyway, without talking too much about myself, I do think it's important for you to just know that just from a very young age, I just loved fixing things that were broken and creating new and useful things. Thankfully, I became an engineer as a result, and I spent most of my life working as an engineer and a business person and in some innovative roles. Now, as I'm sure many of you appreciate, our good Lord works in mysterious ways, right? So somehow I just might see myself here today talking with you about the very real need to make the lives of our elderly brothers and sisters just better and more dignified. And with respect to that, what we can do to help fix things that need to be improved. And this is, again, very much in line with what you've already heard from the first two presenters. You can bring up the next slide, please, Kathy. Thank you. I'm coming through okay with the audio?
Yes.
Okay, because you're cutting in and out.
Yes.
As long as you can hear me, that's fine. Okay.
Yep, we can hear you. Thank you.
Okay, great. So I guess my first experience with elderly care was way back in let me say cherished childhood days in the late 60s, when, as you can see here in this picture, my dear maternal grandmother Maria, she left Italy to come and live with us for a few months, because as I found out years later, my mother was actually suffering from quite serious depression. But all I remember from those times are just Nonna being, 100% loving, and of course nothing but soul-filled warmth. So just fast forwarding a bit to 1983, this picture here was from a visit to Italy, and I think it just expresses my love for Nonna in a very sincere way, to better times when hair was actually good hair was taken for granted. This picture as well is, as you can see from the top right there, it's taken from an article that the Catholic Register was kind enough to publish. I think it was last summer, August, I believe, about the launch. It was the launch of Life Care Network. So it's a not-for-profit ministry that I started with the mission of, I think, as you saw on the first slide there, just empowering seniors to live in the comfort of their homes with dignity and quality of life, right? So that's sort of our motto. I'll talk more specifically about our mission and what we actually do and how we can help. But it's probably better to first address a question that's likely coming to mind for most of you. So how did this guy end up doing this? Well, here we are. Let me start with a number of years ago telling you that I ended up being really the primary caregiver for my dear mom and dad, as you can see here, when they were each respectively in the last phase of life. And I think it's important to add, within the context of this discussion, that this was prior to the legalization of MAID, or euthanasia, in 2016. So basically, if I'll just proceed now to tell you about just some hard-hitting, life-changing experiences that really left an impact. So though I trusted in the doctor's Hippocratic oath, right, and our esteemed medical system, let me call it that, an interaction with a physician in a hospital emergency ward with my mother a few months before her death really ended up shaking me up. So basically, soon after my mom's admittance to, it was basically to a Toronto hospital's emergency ward, as a result of simply feeling weak. She was a very frail woman, very saintly woman. While I kept vigil, let me put it that way, by her side, I couldn't help but notice, so nurses were coming by, right, doing checkups and whatnot, but every few hours they were coming by to draw blood. And that seemed to me to be excessive, especially with mom being so frail and weak, right? I mean, it's just common sense. Anyone would have realized that. So I did at some point question one of the nurses about why is this being done so frequently, right? But it was simply a canned reply back. It's just necessary. Okay, so let's just park that for a bit. Then after a while, this kind doctor, very kind, she was so kind. Oh, she comes by, all smiles and everything. And after some initial chit chat, suggests, why don't you just let her go? Why don't you just let her go peacefully? You don't do the blood transfusion, right? Just let her go. So I vividly remember still speaking with Mom about the need for that blood transfusion in order to keep her alive after the doctor's offer, where she thankfully, simply said, "Of course, of course, I want a blood transfusion." So there's a real bit of learning there, which I hope all of you can also benefit from. More importantly, Mom and I continued to have some of the most cherished, memorable quality time of our lives until she passed a few weeks later. And I remain ever thankful for this grace. As for Dad, who passed a few years after Mom, next slide, please, Kathy. Here too, I was somewhat startled to hear that all his medications, previous slide, please, Kathy. All his medications would be stopped when he entered a long-term care facility in Toronto in order to, I still remember the words, establish a baseline for treatment. Again, I had this gut feeling this just didn't make any sense, right? But even after speaking with his primary care physician, unfortunately, I again just trusted in the Hippocratic Oath, right? Where, by the way, if any of you don't know the words, I didn't. I needed to look this up. The oath actually pledges physicians to, quote, to prescribe only beneficial treatments according to his or her abilities and judgment, to refrain from causing harm or hurt, and to live an exemplary personal and professional life, unquote. So really, in summary here, these early painful seeds, along with much time spent in prayer, especially as a Catholic before the Blessed Sacrament, led to, let me call it a grace-filled inspiration to start Life Care Network. You can go to the next slide, please, Kathy. So what are we all about? Again, we see ourselves, and I know for sure Kathy and her team see our relationship as very complementary, right? So what we're about is we're basically a free service, a free referral service that provides, you can read the words here, I think you can, right? So it's professional and compassionate home care services, right? Based on what we call Christian moral principles. So basically to be ethical. We're targeting elderly clients, but it's really open to anyone. And of course, such services have to be tailored to the unique needs of each individual. So without quoting any polls, I'm sure all of you fully appreciate the need for the elderly to live in their homes as long as practically possible, right? That's what most of us, if not all of us, would want before considering a move to institutional care. But two, at the same time, the reality for most of us who are blessed to live to a very long age, right, or old age, is there will come a time when we will likely need long-term care, right? That's just a hard reality as well. Kathy touched on this a little bit, but it's critically important to have a trusted family member, friend, and or power of attorney for personal care, right? To provide watchful oversight, especially if you're, elderly. And I can't also emphasize the importance of this enough, because as I'm sure you realize, what's fueling, let's call it the hospital culture of death, is number one, there's pressure to reduce healthcare costs, right? It's a proven fact. Most people spend most of their or in need of their healthcare mostly towards the end of their lives when they're elderly, right? So get rid of those costs by getting rid of those people before they need too much care. And number two, this was something that I hadn't realized, and I just came across the other month. The next generation of doctors, so that the doctors who are being trained now and likely into the recent past, or more so even not the so recent past, they're no longer being trained to gradually bring their patients back to health, but they're being indoctrinated to execute procedures rather than critically examine the specific needs of each patient and develop a personalized treatment plan to help them get better. unfortunately, the hospitals have become these, especially, they're so burdened by costs, especially our publicly funded healthcare system, right? So it's all about reducing costs, right? Because how else are they going to do it? And I'm so sorry for coming across that bluntly. So those of you that don't yet have such a trusted person to rely on, I encourage you. Wonderful resources here through our friends at Compassionate Community Care to really try to move forward at the same time with, let me call it, proactive awareness and wise vigilance. Okay. Next slide, please, Kathy. It's one thing as well to, keep an eye on things that don't seem right or fair, and another to proceed, very important, with the necessary, let's say, tact and diplomacy to rectify such situations. And imagine for a moment, while I was with dear mom there in that emergency room, if I would have lashed out at the doctor. The hospital would have had security walk me out the door, banned me from being with mom, and just leaving her even more helpless and vulnerable to the culture of death there, right? And ironically, that would all have been in the name of keeping hospital medical personnel safe from this dangerous individual who just really sincerely cared about the interests of his mother's well-being, right? Anyway, next slide, please, Kathy. Wonderful quote from scripture here, as our Lord commanded, "Behold, I send you forth as sheep in the midst of wolves. Be ye therefore wise as serpents and harmless as doves." And I think this is just so applicable within this context here. It took me too long to realize that in my life, by the way, as a passionate Italian or someone of Italian background. Within this context, there's an additional risk. That's fine, Kathy. Next slide. Thank you. There's an additional risk here, really. I was made aware of this, I think it was just before Christmas. A provider within our network simply told me this one day during a discussion. In Ontario, doctors and healthcare providers actually have the legal authority to revoke anyone's power of attorney for personal care. Right. So, there's a noble intent behind the supporting legislation here to keep people protected from, potential medical abuse and negligence. But of course, it's also opened the door, right, to as we've seen with COVID, right, to trampling of individual rights by our public health system for, quote unquote, the common good, right? Now, there's this obscure government website. If you could please bring it up, Kathy. Thank you. I hadn't even heard of this group. It's the Office of the Public Guardian and Trustee, and they've got this this Orwellian government right explicitly outlined on its page 24. I'll give you that too, on their questions and answers guide of their powers of attorney page. There's just a lot here. I don't know if you can read that writing, but again, it's just basically, it's the legalese behind giving a consent and capacity board the right to assign a court appointed power of attorney for you if, here's the kicker, right? If they believe that your health or long-term care decisions are not being made properly by your attorney. So they can basically, if they feel that way, they can basically ask a judge to remove your attorney if this is the only way to, second kicker, protect you. Okay, so just be aware this is happening. It's just spelled out on this, again, this just obscure government website that of course nobody can find or would find, and of course never reported on by the liberal funded mainstream media. Okay, so that's just really some background, which I hope is helpful. We're now just quickly going to circle back to our mission at Life Care Network and how our process works. Kathy, just a time check. How much time, please, do we have?
Yeah, like 5 minutes. Is that okay?
Yeah, that's perfect. Sure. So I've mentioned, we're basically a free referral service, right? For this is the qualifier as well, right? It's really for seniors that are looking to hire an in-home caregiver, right, to provide additional support beyond PSW hours that are already provided by the provincial government or paid for by the provincial government. So if you or anyone you know have a need, please contact us anytime. Next slide, please, Kathy. We simply have a discussion to understand your needs. You know, it has to be client driven, much along the lines of what you've already heard from our previous speakers. We then we have access to a database with many experienced, compassionate, professional caregivers, and it's even we can even search that database on a geographic basis, right? So we can find somebody excellent who's 100% against euthanasia and who lives close to you. We also, per a previous question, we do conduct the initial interviews and screen the candidates. So we do that to ensure potential caregivers could be a good fit with what you need before setting up a meeting with you, you know, for your interviewing, of course, before they would be hired. And then basically that's how it works. And if the caregiver is a fit, they're hired and off we go. I'd like to just stress that we are a referral agency, right? So we don't actually hire the caregiver, but that's a good thing for you or your POA or trusted family friend, because there are significant tax benefits to those who actually end up hiring a caregiver, right? But no worries if you need some help navigating through that and how to make it most effective. We do have a concierge service where we basically handhold clients through that process and can even take on some of the administrative burden, because we want to, in the end, you need care and you don't need you don't need to be burdened with all of the supporting administration. Just a quick thing, moving towards closing. When I was setting up Life Care, this was back in May, June last year, clearly it would be important to understand if there were similar services already available, right? So I did a quick internet search. So all these caregiver agencies start popping up with the words, you know, compassion, dignity, respect. I mean, splashed all over their websites, right? So I get the sinking feeling, oh, we're just duplicating effort here. Like this stuff's already being done. So as you started to drill down into these organizations, it was revealed these were actually not all about that, because they also strongly supported euthanasia and MAID, disguised as dignity and all of that, right? So thankfully it was a rejuvenation with hope that there is a definite need for us to do this. I think we're likely the first pro-life senior organization in the world, senior care, but to God be the glory if that's the case, or even not. And I'm just going to close here quickly. Just a couple of recent caregiver interactions. The other week, our dear friend Kathy here, she approached me to ask if we could provide some additional care for it was actually a middle-aged lady. She suffers from chronic pain and she needed some help with various chores around the house because her PSWs basically refused to assist her with even the smallest tasks. So I'm really pleased to say within 24 hours, we were able to find just a wonderful, wonderful young girl. And they now have an excellent caregiver relationship. It's ongoing and they've been bonding ever since. And we didn't get paid a penny for that, which is totally fine. And this is my final little story here, if I may, a very touching story. There's a kind elderly lady, really humble person. All she tries to do is simply stay close and be a friend to the lonely, vulnerable seniors in her retirement residence, just as a genuine friend, and to provide reassurance that basically life is worth living. And we do stay in touch. And she mentioned to me the other day that one of her close friends she was most worried about now no longer talks about killing herself. Unfortunately, as we heard earlier, this is even being suggested by doctors. And actually, I'm recalling now, I think that's what put the idea into this poor lady's head. What a humble ministry, just to serve the poor, as our dear Lord commands. Just beautiful. So I think that's pretty much it. Kathy, I don't know if we have time for questions, but I'd be pleased to try and answer any if we have time.
Any questions? Yes.
Is this going to take place in a retirement center?
So the question is, does it take place in a retirement center? Lino?
It can.
It's-
It typically, yes, it typically will not, but it can complement what's already being provided in a retirement center, or it could just be, if a senior is living at home or in their apartment.
Yes,
Is it voluntary thing or
pardon me?
is that voluntary or?
Voluntary?
Yeah.
Is it voluntary? Lino, excuse me.
Typically, if it was voluntary, I'll have a really easy answer. Compassionate Community Care and our friends here would be able to help you with that. Yeah, this is where that's a really good question, actually. This is where there would need to be more prolonged, regular care, right? If you just need someone to maybe call or visit once in a while, you're doing pretty much okay, then it would be more compassionate community care. This is where you need extra care, say a few days a week or something like that, ongoing, right? Which the caregiver would expect some payment, but it's quite reasonable in terms of that.
Yeah. On average, roughly, would you say, $25 an hour is the average benchmark?
Yes,
Per
it
hour
can
for
be.
her.
Yes, it can be slightly less, but typically, yeah, we would want it to be fair to the caregiver. The one I spoke about, actually, it was in Toronto. She spent probably, I would say, an hour and a half or 2 hours, traveling to the person I mentioned, only a couple of hours that day. And, she didn't charge for travel time or TTC, right? So yeah, 25 is about fair, I think, yeah.
Any other questions? No? Okay, perfect. Thank you very much, Lino. We appreciate your time and your presentation and insights.
Thank you.
Wonderful.
Thank you so much.
Thank you. So that's great. Thank you so much. And what I'll do is ask our headline speaker, keynote speaker, Father Nikolai, to join us, sharing a little bit about his work here, this wonderful church. No, okay, perfect. Yes. So we'll just turn this over to you, Father Nikolai. Thank you.
Thank you.
Thank you, everyone.
So I will say, like in Toronto, I came to Toronto 20 years ago. And it's not specific to Toronto, but if you look at all modern, postmodern countries, social isolation is a big issue and it's becoming a bigger problem, like as the years go by. If you come as an immigrant here, you think it happens only to you, but that's not true. I think for some of us who live around, like within the community for, I don't know, last 20, 30 or 40 years almost, we understand that all the time in any society, if you have people who are marginalized or cast aside. And the community here, since it started almost 4 years ago, pretty much tried to be a presence to those who kind of are considered not worthy by the society for different reasons. I can tell you my first experience of Canada or loneliness here was 15 years ago when I was doing counseling. And I had this wonderful, really smart young person. He was in his 20s. He started 1 year at UP and he dropped not because he was not smart enough, he was very smart. Just because he had this kind of social, like awkward social, how can I say, incapacity to relate to people. And he was extremely smart. He's like almost like a genius, and had extreme sense of humor, but he had nobody in his life. And I couldn't make sense of that myself. Like, how is that possible? Like this person who was young in his 20s, he was like looking very good, and very smart, and he had nobody in his life to talk to. So I thought, like, this is strange for me. And I can hear that within the community, loneliness can take different forms. You can see people living on the street, you can see people who are they're shut in the apartments, people who battle with addictions, all kinds of different ways. But now I think the social isolation is kind of generalized within the city. Not only in Toronto, I can remember maybe 10 years ago in UK, they had a minister designed to social isolation. That was before even Indonesia came into being in Canada. So that has been a reality that has been growing. Here, what is the community God is trying to do is try to create a kind of a community around the church where we pray and we're physically present, as Thomas said. So we are here, we made this commitment to be here and to welcome people. And to try to build relationships with people in a time when, these relationships are not real. So all of us, we suffer in our own life because of this social isolation, but we don't realize it. Like I can tell you, my family, I have kids, they suffer from it. They don't go to school. All of us, we suffer in different ways, but the most vulnerable ones, what happens now, their life is at risk because of this. And that's what we have seen lately. And not only that their life is at risk because we are kind of, we don't pay attention, which is true, but our society made it legal so they can really, their life being at risk, they can really take their life, period. Right? So that's what, when we talk about euthanasia and other, and we have been witness and testified here within the community, like people's life who struggle with all kind of difficulties in their own life, that there is a pressure from the system, not only like the elderly, yes, that's how I can say it first, but people with disabilities, people with addictions. Like I remember it was 7 years ago when a person who was young, who was in her 40s, she used to come here every morning. She had problems with addictions. She couldn't have a kidney transplant because she was addicted to drugs. Right? So that happened 10 years ago. So these stories, we heard them over and over and over again. I think what we recognize today that those are the most vulnerable, are the most really at risk. And we try different ways, I guess, to be a presence, and to be a witness of life. And like in different ways. Within the community, we made a commitment to open here at 5 o'clock in the morning, Tuesday to Saturday, and some days we're here like all day, some other days we're part of the day. And really try to be a presence and a witness of life in the life of the people as much as we can. We do a poor job, obviously, but most of the time. But people they forgive you. It's not so much. You don't need to be perfect. I really have to go because I'm thinking Brother should speak.
Yes, yes.
Because Brother has been working within the community and has a lot of experience. Also, Vasiliki, if you like, Vasiliki, she dedicated all her life to visit people in the hospitals. How many years have you been doing that?
19 years.
19 years, almost 20 years. Every week. And again, I want to say more things just because, like, for the last year, we've been seeing people here in the neighborhood. And sometimes Ileana takes me with her just to see people who want to see a priest. And I think it's good not just for the priest to speak,
Yes.
It's like, let
Yes.
other people, those who do real the work. I'm here just a coffee.
Thank you.
Okay, thank you, brother.
Thank you, Father.
Thank you very much. It's put a lot of stuff in perspective on my behalf, because I get a lot of calls, every night from the Greek community that I know people, and around 9:30. I'm waiting for your cow. I want to hear your voice. So every night I call Julie, hi, how are you? Okay, I can go to sleep now. For a while, I used to get upset, I go, shoot, again. But as time goes by, I go, if you can soothe somebody's, comfort somebody. She has children, but for some reason she finds it comforting to hear. And I have another Greek lady too, every day. please call me. It's Katerina. I call her, hi Katerina. Oh, okay, I'm fine, bye. Nothing much, but
Yes.
just a few things.
To hear the voice
And-
on the other end.
Yes.
Realizing through this now, it makes a lot of sense and being able to, and on the phone all the time, people talking, just listening to people's, not always elderly, there's also younger people.
Yes.
And all you do is just listen to what they're going through and no comment, nothing, just listen.
That's
Thank
beautiful.
you.
Thank you. Thank you so
Yeah.
much for what you do.
I just. Your calls, they tell me Vicks is good for my arthritis. Can you get me some? Okay, I'm gonna get you some Vicks. And then it's just all these little things, but if you can put a smile on their face.
Yeah.
Then,
Mhm.
it gives me peace.
Yes,
Yeah.
amazing, beautiful. Thank you for sharing.
Thank you.
Thank you. Yes.
Yeah.
Yes, yes, please. Yes.
I was just thinking right now, prayers are good, there are people that text me. They ask me to pray for, family members or friends from other countries for different reasons. And I do it, I pass the information to Father, I write down, the names for Father to pray for them.
Yeah.
Because I find it it's better when Father does that. And, just recently, I didn't know what to do. There's a person that I speak also very often, and, just told me that, this person is not, the other person is not a senior, but it's a mom. I don't know the person, and I was told that, for some reason, the person was saying that, she wanted to harm her kids, right? So at that moment, I was shocked, I was worried, I said, how can I help? Try to get help, I told the other person, try to get help. I said, you never know, maybe she's under stress. It could be the partner, it could be work, it could be, I was like thinking, because there are so many reasons, you cannot blame a person, that's what I feel. You cannot blame the person, you don't know what's going on in their day. Or maybe their kids are being bullied and she's getting stressed about this, and so many good reasons, and I said, try to find out. Before anything, try to find out. So this person did a lot of research on the person and all this. Finally, told me that, the person was without the medicine, did not took the medicine, I guess, for the day, or who knows. And that was causing the problem.
Mhm, mhm,
They spoke to the kids, they did another research about,
mhm.
they said they love their mom. The mom was the best, they love her so much. So my conclusion is, you cannot judge a person just because who knows what's going on in their day or weeks. And this person does not have a way to say it to somebody else. And in a moment of stress, there are so many things that people can say, but they don't mean it. They don't want to hurt no one,
Mhm.
but it happens in a day. I feel that no one is perfect, but we should come out with conclusion and try to help instead of judge, right? That's my thinking. And then, I heard another story that something happened to another mom and no one got help for this mom. And, something bad happened to the mom, right? So we have to look, we could be here, but there's in other countries that people need help too in prayers.
Yes,
And my belief is, we should do prayers, no matter what religion, it doesn't matter. If you're a woman, man, or kids, or grandmas, or whatever, we should pray and hope in God that He should listen to the pray for us, for the ones that we care, or the unknown people that we don't know. But, also I trust in, Father for him to pray for all the people that are in need, right, all around the world. So that's my thinking now. I'm always worried about everyone else to other people.
Yeah, yeah,
Yes,
absolutely. Thank you
thank
for
you.
sharing. Thank you. Sister, did you want to share anything before? No? Okay. Anyone else? Brother Luke?
I just say, I can think of like, there's 3 or 4 people who we know about who want to be visited. And it's a great witness of the church. I think, we were talking about sisterhood and brotherhood the other day, because we have some new sisters or renewed sisters in the community. And someone was saying that like a sister is like someone who cares for someone else without self-interest. And I think like for someone, yeah, like someone to do that. Without interest, just for the concern for the person, like it says a lot. And we benefited a lot from the training in compassionate care. And there's people here who've been to the training, and can guide us to visit people and do it in a thoughtful, way, as church.
Mhm.
And so if anybody, if anyone is interested, please talk to us.
Yes. Excellent. Very good. Thank you. Good. Any other feedback? Anyone would like to talk about their experience? Yes, please. Yeah.
Is this on?
Yes, it is.
Okay, well, hello, my name is Linda. I'm 75 years old. I think I'm a senior, but I'm not sure. But I feel 21. I come to the church every day for lunch. I sit on the ethics committee. I recruit volunteers with a smile. And I've gone to the senior citizens building to sing for them, and I'm not even a singer.
Amen.
I just love this place. I feel 21. I don't feel my age because I'm busy. And I got 2 dogs to top it off. It wasn't bad if I got 1, but I got 2. And I just love this place. And what keeps me going is this church.
Yeah. Amazing. Thank you. Any others? Yeah, no, okay. All right. Well, wonderful. Thank you, everyone. Is there any questions, comments, feedbacks from the crew here, crowd online, perhaps? No? Okay. So with that, I think that's a good conclusion. Thank you all for joining us. I do encourage you to sign up tonight. We do have a Being With volunteer visitors training. Yes, yes.
I would like to have a few cards.
Yes,
Maybe I can pass
absolutely.
it to
Yes.
the buildings and the seniors.
For sure, yes. Mind if I ask them to come back or pass it over? Thank you. Yes, so we do have a training tonight as well, online, and it will be from 7 to 9 p.m. We had emailed everyone who's on our email list a link to join in. You'd have to register and then you'll get a confirmation Zoom link. That will get you entry into the Zoom tonight from 7 to 9. I'll be speaking tonight. Tomorrow, our good friend and colleague Alex Schattenberg will be speaking from 7 to 9 p.m. And so we'll both be covering topics associated relating to visitors training. So for example, we start with your human needs, the 4 basic human needs. We talk about why it's important to visit, our philosophy around visiting, which some of you are already doing. So great on you. That's great to hear. Then we talk a little bit about how our My Story approach is different and more very practical way you can do that. And finally, we talk a little bit about tomorrow, you'll hear from from Alex about communicating with people with disabilities, patient advocacy at the doctor's office, and finally, how to prevent and notice elder abuse when it arises and how to ultimately stop it. So with that today, I think we'll conclude. Feel free to join us if you want to get information or updates from us. We don't send them out often, probably once every maybe 2 weeks, but we would love to be in touch with you here. This is a beautiful community. We thank you, Father Nikolai and Father and Brother Luke and the St. John the Compassionate Mission for all the great work you've done. And so we look forward to sharing this video recording with your community after it's ready and edited. So have a wonderful day.